Broadcasting from Detroit's Gas Corridor, it's the Metro on WDET. I'm Robin Vincent.
And I'm Tia Graham. Today on the show, soul food began as a story of survival and determination, turning leftover ingredients into culinary treasures.
We'll learn how Detroit chefs are remixing that legacy with fresh and flavorful ingredients.
Also, teen violence in Detroit is on the rise, leading police to tighten enforcement of the city's youth curfew.
But Detroiters are wondering if curfews tackle the root cause of violence and how the city can provide real opportunities to help young people thrive.
Plus, when the NBA door closes, the Big Three window opens right up, and Ice Cube holds the key.
This league has become the buzzer beater for basketball veterans and fresh talent.
And Detroit's got game, too, with the electrifying Detroit Amps.
But first, healthcare in Michigan is about to get more expensive. Insurance premiums are expected to jump 15% next year. Some plans even propose 20% hikes. Medicaid is set for $1.2 trillion in national cuts, including work mandates and higher fees. Meanwhile, Michigan Attorney General Dana Nessel just joined a lawsuit to try and protect hundreds of thousands of residents who have insurance under the Affordable Care Act in Michigan. So, what does this all mean for you and your family's coverage? Thomas Buckmueller is here to explain. He's a health economist at University of Michigan. Professor Buckmueller has advised presidents and tracked reforms globally. Today, he'll break down what's changing, who will be hit first, and what Michigan can do to soften the blow. Professor Buckmueller, welcome to the program.
Thanks for having me.
So before we look at how Michiganders will be impacted, I want to zoom out, if we could. You've advised former Presidents Obama and Biden on health policy and reform. So I'm wondering, if President Trump called you tomorrow and asked your honest opinion about this budget, what's the first thing you tell him?
This is a disaster for healthcare. And this is going to be the biggest cut in Medicaid ever, comparable to what would have happened if he'd been successful at repealing the ACA back in 2017. So certainly runs contrary to his claims during the campaign that he was going to protect Medicaid.
So you see this as having huge impacts across the board. I want to talk about one of those impacts. Premiums for many Michigan families are about to jump, as I mentioned, as much as 15 to 20%. And this is because premium tax credits implemented under former President Biden are set to expire at the end of this year. And President Trump's tax and spending law didn't extend those tax credits. Do I have that right?
Right. That's a big part of it. That's not the whole thing, but that's certainly a big factor.
Okay. So first, could you explain what a premium even is? And then let's talk about who will be hit hardest.
Sure. So the premium is the price of a health insurance plan, and it's going to reflect the cost of covering care under the benefit structure. And the premium tax credits are a way to make that more affordable for middle-income families. And so with the ACA established the marketplaces, which is a place where if you don't have employer-sponsored insurance, you can go and shop for a private plan. And depending on your income, you qualify for a subsidy. So in 2021 and 2022, there was legislation that increased the value of those subsidies, made marketplace coverage much more affordable for people who were already eligible, and made new people eligible for these tax credits. And so that had a very strong effect on enrollment. The number of people getting private coverage through Marketplace more than doubled. So right now it's up by about 25 million people nationally. Those tax credit enhancements were temporary, and they're set to expire at the end of this year. And so letting them expire effectively is going to increase people's out-of-pocket premiums by about 75% on average. Now, it varies a lot across the country, depending on your age and your income, but that's sort of the average effect.
75% increase.
Yeah.
What do you think that's going to look like in Michigan?
Well, so we're already seeing what it's going to look like. As you mentioned, a number of Michigan health plans have announced rate increases of between between 10 and 20%. And part of the dynamic is when these premiums go up because of the loss of the subsidy, the people who are most likely to drop coverage are going to be younger and healthier, who decide, well, I'm just going to take my chances and go without insurance. And that means that the people who remain insured are going to have higher health care needs. And because of the way premiums have to cover costs, the insurance companies are going to be increasing the total premiums even more to account for that, what we call adverse selection, sort of the worsening of the risk pool.
So what you're saying is that a lot of Michiganders rely on ACA subsidies to afford health insurance. And when these subsidies disappear, healthier people, younger people are likely to drop coverage, and that's going to make premiums even higher for everyone else.
Correct. And the One Big Beautiful Bill Act also has a number of other administrative features that sort of introduce barriers to getting coverage, to getting your tax credit, to staying covered, and that's also expected to reduce enrollment. So the combination of higher premiums and just these administrative hurdles, we can expect coverage to fall quite a bit.
I want to look at Medicaid for a moment, if we could. I realize that you worked on Medicaid expansion for the state of Michigan, and it is facing deep cuts and new requirements, and that includes mandatory work and higher fees. In simple terms, how will these new rules impact people who rely on Medicaid in Michigan?
Sort of like what I described with the marketplace. It's a new set of bureaucratic red tape that's going to make it harder to prove that you're eligible and harder to keep your coverage. So the work requirements are really best thought of as paperwork requirements. We know that the majority of people on Medicaid nationally and in the state of Michigan already work. And those that don't are caring for a family member, or they're in school, or they have some other reason that would, technically qualify for an exemption to these work requirements. The challenge is proving that you're, meeting the requirement, submitting the necessary paperwork, and staying eligible. And that's why we expect so many people to lose coverage, not because people aren't working, but because we know from past experience from Arkansas, which is the one state that implemented work requirements, and Georgia, which has a program right now that has really strict work requirements. We saw a lot of working people fall off the rolls because it can be nearly impossible to navigate the system.
Yeah, that's something that we've talked about a little bit here on the Metro, is the existing bureaucracy for folks on Medicaid as it is. Can you describe that a little bit, the hoops that people are already jumping through?
Well, the hoops were getting easier to jump through. I mean, one of the things that the Biden administration did was try to simplify enrollment and eligibility processes, make it easier for states if they have existing information on somebody's income. They can sort of look in their databases and see, okay, this person is enrolled in food stamps. We know that means their income is low enough to qualify for Medicaid. We're not going to force them to go through this hassle. We're going to automatically renew them. States have also gone to longer eligibility periods, not having people have to re-enroll or recertify, every 6 months. People's incomes vary, but it's, most people who are very low income one year are going to be low income the next year. And so we had been moving towards a more streamlined system, a more efficient system, and that translates to lower costs for the state and better coverage stability for people. There's this concept we talk about as churn. People who are eligible for coverage and they get sort of, kicked off temporarily, and they get back on, and they've got to reestablish their their connection with their provider. And that's costly for the state, and that's costly for patients. What a lot of the sort of fine print of the new law is trying to introduce a lot of these hurdles again. So instead of saying that you can maintain your eligibility for 12 months, now you've got to recertify every 6 months. And it's just putting more of a burden on patients and, again, making the system more costly.
So you were seeing things moving in the right direction, and in your eyes now it feels as though this country is taking multiple steps backwards.
I think that's right, yeah.
This is the Metro on WDET. I'm Robin Vincent. We're talking about how health insurance will change for Michiganders under Trump's new cuts. Our guest is Thomas Buckmueller. He's a health economist specializing in health insurance at University of Michigan. Professor Buckmueller, I want to zoom in a little bit more on the local impacts. Hospitals across the state depend heavily on Medicaid funding. Can you talk about these cuts potentially forcing hospitals to scale back services or even shut down? I mean, I realize that's a concern, at least in smaller towns and rural areas.
That's right. And again, we can look to the experience of what happened when Michigan expanded Medicaid with the Healthy Michigan Plan and sort of then run the experiment in reverse. So when the state established the Healthy Michigan Plan, hospital uncompensated care, that's the combination of charity care, where hospitals say, we just know this patient can't pay for it, and bad debt, where they bill the patient, but then ultimately the patient can't pay. That fell roughly in half after the implementation of the Healthy Michigan Plan. The number of uninsured patients fell dramatically. And so that really improves the finances of hospitals. And as you mentioned, especially rural hospitals, which rely more on Medicaid and have a smaller patient base. And so they don't have the cushion to absorb these cuts.
Now, if people lose Medicaid, it's likely that more may rely on emergency rooms without insurance. So could this raise healthcare costs, even for people who have insurance through their jobs?
Well, it could, as you mentioned, it could actually reduce services. If hospitals that are currently relying on Medicaid say we can't keep this emergency department open, it'll raise costs, but also may mean that people have to drive further to get coverage or to get care, or may not be able to get care at all. So there are important spillover effects. It's a complicated system, and when you take such a big chunk of financing out of it, the pain gets shared.
Professor Buckmueller, if these healthcare changes fully take effect, I'm wondering from your perch how different you think healthcare might look for an average family in, let's say, Detroit or Detroit suburbs or parts of rural Michigan.
The strongest effects are going to be on people who lose their coverage. The experience of the Medicaid expansion and expansion of coverage generally really points to the value of health insurance coverage. We know that when people have coverage, they're more likely to go see their primary care physician. They're more likely to be able to fill prescriptions, manage their chronic conditions, manage their mental health. And if you take that away, the health impacts are real. And ironically, I think it's going to impact people's ability to work. So these work requirements, if they have any effect on work, is probably going to make it harder for people to maintain steady employment. At the end of the day, we have strong evidence that the Medicaid expansions through the ACA reduce mortality. And so I think such big cuts coming, we can expect mortality to increase.
This is the Metro on WDET. I'm Robin Vincent. We're talking about how health insurance will change for Michiganders under Trump's new cuts. Our guest is Thomas Buckmueller. He's a health economist specializing in health insurance at University of Michigan. Professor Buckmueller, your research, among other things, has highlighted gaps in healthcare access. And so this has me wondering, how could President Trump's new budget deepen health inequities, particularly for communities of color in Michigan?
Well, take Wayne County right now has the highest rate of Medicaid coverage as a percentage of the population of any county in the state. So I think, Detroit will be hit hard. And it also cuts across different economic variables. So, before the Affordable Care Act, if you didn't have access to employer-sponsored insurance, if you didn't work full-time for a large firm, you had a really hard time getting insurance. And the Affordable Care Act has really leveled the playing field by making these affordable options available. So if you're a low-wage worker, you have Medicaid. And if you're sort of slightly higher income, but still not, maybe you're a gig worker, coverage through the exchanges, the marketplace. And so I think that's going to some of those inequities are going to reemerge. If you're self-employed, if you're working for a small firm that doesn't offer insurance, you're going to be hit the hardest.
You're talking about some of the unsung, some of the lesser known impacts, positive impacts that the Affordable Care Act has had. Could you talk a little bit more about some of those lesser known benefits that the ACA has had?
Yeah, I mean, just thinking broadly, having a good safety net allows people to take the job that they want to take, not because it offers insurance, but because, they've got a new idea to start a business or they've got a passion. Before, we were really concerned about this idea of job lock, that people were constrained because they needed to work for a certain kind of company to get health benefits. The ACA really loosened that constraint up, and in the process, you could argue makes for a more vibrant economy. People can take the chance to start a small business, to be a freelancer, to retire early, to do things that they want to do, because they're not so concerned about where they're going to get their health benefits. So I think that is an undersung aspect to coverage expansion, to healthcare reform. But the biggest effects are the health effects and the support for the healthcare system. So that's probably where we're going to see the biggest impacts. But these other changes are not insignificant.
Well, Professor Buckmueller, we have laid out a lot of problems here, so I think we'd be remiss to not try and look towards some solutions. So let's do that now. If federal cuts are inevitable, and it seems they are, what actions can Michigan take to keep health care affordable for families?
Oh, boy. I think that the Medicaid system relies so much on federal funding. I think the state's going to be pressed to come up with funding to mitigate the impact. It's going to be hard. I'm not sure there are easy solutions. I mean, to get the Affordable Care Act, even with all its warts, was a huge political undertaking. It's had a major impact on our healthcare system. It's not going to be easy to reverse these kind of cuts. I'd love to have a silver bullet, but I'm not sure there is one.
Well, what about looking at things on the state level? I mean, I'm thinking about how some states are exploring their own insurance subsidies or public options, and that includes states like Washington, Minnesota. I was living in Colorado when it installed its subsidies, and soon New Mexico is going to be a part of that list as well. Would you say are residents there in better shape with those subsidies or public options?
Certainly, if you can come up with the financing to offset some of the tax credit loss, that would definitely have a positive impact on coverage. I'm not sure if we know exactly how the work requirements are going to play out, and it's possible that a state that really cares about coverage can implement them in a way that sort of is more humane and isn't so punitive. So I think maybe it's some of the in the weeds. Maybe the state can do a lot of things to reduce the harm. In addition to any way to offset the funding loss will be a good thing.
Yeah, can you think of any examples that the state could do? Because Michigan doesn't seem to have the political will to go down the path that some of those states I mentioned have gone down. What are there other things you could see the state doing to ease the pain?
To be honest, it's hard for me to think of because these things are expensive, right? And there are a lot of other priorities, and state budgets are tight. States can't run deficits, and so. If you're a large state like California, maybe you have more levers. But, if Michigan faces a lot of economic challenges. And so I'm not sure that it's an easy lift.
So sounding a little grim, I'm wondering are there ways Michigan hospitals and communities could work together creatively to maintain services even as federal funding dwindles?
Well, I'm sure they will. We're essentially returning to, a pre-ACA landscape. And so hospitals, have operated in this kind of environment before, so I'm sure they'll figure things out. But yeah, I don't have specifics to suggest.
Before I let you go, Professor Buckmueller, you've studied healthcare reforms around the world. So what's one smart, practical idea from another country that could help Michigan and or more broadly the U.S. better cope with shrinking federal healthcare funding?
Well, we're the only industrialized country in the world that doesn't have fully universal coverage, that doesn't treat access to health care as a fundamental human right. And the fact that we don't makes our system much more complicated and costly than other systems. You don't have these complicated eligibility rules other places. It's just sort of taken as a given that everyone deserves access to care. So, I think if we could ever get to a system where we have that philosophy and we live by it, then I think we would not only have a system that's more just, but one that would be more efficient and easier to navigate.
Thomas Buckmueller, he's a health economist at University of Michigan. Professor Buckmueller, thank you so much for joining us on the Metro.
Yeah, thanks for having me.
This is the Metro on WDET, Detroit Public Radio. Last week, President Trump and Congress revoked all federal funding for public media. That totals $1 billion that was previously approved by Congress. It would have gone to the Corporation for Public Broadcasting. These cuts are a significant hit to us here at WDET. We used to receive hundreds of thousands of dollars from the CPB every year. Now, the station isn't going anywhere, but locally produced programs, including the Metro, are at risk. There is something you can do, though. WDET is looking to add 1,000 new members. Join Team DET and fight. Fight to protect local news, fight to protect democracy, and Detroit-made public radio. Go to WDET.org/save. We'll be right back on the Metro. Stay with us.